Good morning, everyone. I hope you all are doing good. This is the Medical Billing Blueprint series, a special episode for a lot of people out there, from our own industry who are being confused. So, I heard recently that basically, it's something which is very interesting that people are confused what exactly I do. What exactly actually I do. Am I a medical biller, a credentialing specialist, a coder, a digital marketer? Do I work with MIPS, Hades, PCMH, or compliance, patient coordination departments, the patient care, or a business development? So my answer is um, I understand all of them, but that's not my niche. My niche is actually closing. So, by closing, I wouldn't say that I'm the one who can sell you everything or something. A closer understand the situation well enough to connect problem with the right solutions, right? So that's why I have to learn everything, you know, because what I've understand so far is you have to learn credentialing because you need to understand why exactly the provider couldn't get paid. You have to learn coding because that affects the reimbursement. The diagnosis should supposed to justify the CPDs and everything. And you have to learn the MIPS, Hades, PCMH, chronic care management, quality center kind of a program. You have to have a basic understanding of them because they can affect how the practice will operate in the future and generate the revenue, right? And you have to learn the compliance side of it because, you know, I would say you cannot advise a healthcare provider while ignoring the compliance. So you have to be up to date all the time for that. You have to be on the, up of the road every time for that. Because it changes. Every state has different regulations, so you have to be prepared for that. And then obviously you have to learn digital marketing side because getting practice paid is just the one challenge. Getting patients through the door is another. So, and obviously my niche, business development side, because that's my core territory. So you have to learn that to get in the business. And obviously you have to learn the underpayment analysis. You have to learn how to read those reports out there, audit reports and everything, because getting them paid isn't the claims paid is just the one problem. You have to understand why either it's getting paid correctly or not. So you have to go every department of that. You know, I'm not claiming that I'm the to be the deepest technical expert in every department, but that's why you build the teams. That's why we build the teams. And but I need to understand every department well enough to identify the problem and bring in the right people, bring them in, and close the situation for the providers. And let's just say I have to learn, I have to go through all of these departments, billing, coding, credentialing, compliance, patient coordination, digital marketing, business development, revenue analysis, all of those, because my job isn't to just sit in every chair with every department, but my job is to understand what every chair can contribute to the outcome for a healthcare practice. And, that's where I have the experience. And the people who know me, they know that what I call myself and others too, that I'm the best closer in the city. But, even though I understand so far that after closing hundreds of the providers, it taught me something that much more important, I would say, that you cannot consistently close healthcare providers if you don't understand their business. And every healthcare provider has different niche of the business or different setup, different foundation, different vision, different state. So you have to learn, about them. So that's what you need to do. Um, and this is exactly why I'm telling you this is because if you want to become more successful in this industry, don't put yourself inside one box forever. Start from somewhere, become great at something, some department, but understand how everything connects. Either, a lot of people think that I might be saying something bluff or something just, grab the attention or something, but you don't need to do every job. Just need to understand the business. And for that, you have to, you know, keep yourself motivated enough to learn every department and everything. It just understand the revenue cycle by itself, and then it will be more easier for you to do your job. Either you're a credentialing specialist or either you're a coder, any department. So what I am actually today, I'm not trying to be the coder or a biller, credentialing specialist. I have people for that, or marketer, or compliance officer at the same time. I'm a closer who can actually get the job done. I understand the pieces. I understand people. I understand their problem. And my job is to connect all of those three to get the solution for them. That's my niche, to make sure that if I'm running a firm or if I'm working with any project, if I'm providing consultancy or whatsoever, I need to understand that, how I can resolve the issue for a provider. Either it's a denial, either it's anything. So for that, most of the people are confused at what exactly I do, why I talk about different, departments. So I believe the confusion has been cleared so far. Yep. And that's actually I do. So I try to be helpful for the healthcare providers. I try to, make sure that I can contribute whatever I have, whatever I've learned so far in the past few years to the healthcare and see if, I can make a small difference. So that's what I'm doing. Sometimes things goes south, sometimes, you win, sometimes you lose, but again, we have to create a win-win for everybody, and that's what we should supposed to do. And that's what is negotiation is all about. That's what this closing is all about, to make sure that everybody's getting win and try to helpful for everybody. Start learning every day. That's what you need to do, guys. So I hope I have made the confusion clear. If you guys have any other, but I'm working on a few other suggestions of yours. I got recently some inquiries and some suggestions from very, kind of the lovely audience that I've recently created for Medical Blueprint. And I would definitely gonna share some of the next strategies that how you can actually increase the patient for a follow for a practice. That's what we're gonna talk about next, and that I believe will be helpful for you guys so you can create more patients for the healthcare providers of yours and try to help them out. So that's what we're doing. And again, most of you guys might be thinking that, sharing this is just, it's just, I like to help people. And I think if I'm helping them in a way that I can, and if that makes sense for them and it can make a little change or an impact on something that you might be doing right now, I'll be happy for that. Again, you know, let's build RCM consultants. Let's just build more jobs for others, just more opportunities for others, and see if we all can, have a win-win. Have a good one, guys. Thank you so much for watching. You have all have a wonderful day ahead. Talk soon. Bye.